Good day, sir. My name is Alexis Agua, and today I'll be performing the assessing the abdomen. So first thing to do is we're going to identify the patient by asking their name and their birthday. So good day, sir. May I ask for your name and your birthday?
Christian Aguanta, December 17, 2005.
And next, we're going to explain the patient for the procedure of the assessing the abdomen and also answer any questions from the patient. So, sir, the purpose of this procedure is for us to identify any abnormalities in your abdomen or any underlying health problems. Next is we're going to ask the patient, so, sir, do you have any questions regarding the procedure? Okay. Next is we're going to perform hand hygiene.
And then after that, I will perform hand hygiene.
And then we're going to help the patient undress if needed.
I will
And
help
then,
the patient in
so
undressing and putting on a
next is we're
patient
going
gown
to
if necessary.
next is we're going to help this patient into a supine position,
Help the patient
and then expose the
position
abdomen part of the patient, and also ensure the privacy of the patient.
Ensuring the privacy of the patient. I will make sure to expose the abdominal
So,
area.
now we're going to proceed assessing the abdomen, starting
So first I
the
will
inspecting the abdomen for the skin
for
color,
any,
contour,
skin
position,
color,
and
contour, position,
also umbilicus.
the umbilicus
So check for any
undersurface
other
characteristics,
characteristic, which is the rashes,
lesions, rashes, and scars.
lesions, masses, and also scars. So inspect. And then, after inspecting, is we're going to proceed auscultating the abdomen for the bowel sound. Bowel sound with all four quadrants. This includes the hypoactive, hyperactive, and the baroregmy, which is the normal sound. And then, using the diaphragm of the
So
stethoscope.
I will follow a systematic
So,
systematic
using the systematic method, starting the
first here.
right up,
The clockwise.
right upper,
So
left upper quadrant, and then lower. Okay. Next is we're going to auscultate the abdomen for vascular sound. This includes the for us to know the Brooks or AAA, the aortic abdominal aneurysm. So, using the bell of the stethoscope, ensure that it is in a bell. Okay. Again, all four quadrants in a systematic method.
Ngayon kalimutan mag-ratio.
So this was the check for any bullets or abdominal.
Next is we're going to percuss the all four quadrants. So using the same technique in percussing. So starting using the systematic method also from the right to left.
Then after percussing, I will now proceed to palpating the four quadrants by
Next is we're going to
using
palpate the four
light
quadrants.
and
First
then
is light palpation, next is good palpation.
We will
So,
lastly
we're going to ask the patient
last
first if
area
there's any
which
pain.
the
So if
patient
there's any
will,
pain in the part of the abdomen, is we're going to palpate
the
that.
first is light palpation. Next is deep palpation.
Next, deep
So,
palpation.
ma'am, let me know if there's any
If
pain.
there's any pain, sir.
No.
No.
How about you, sir? Kuan, sir, sa deep palpation.
Asa po? Rebound tenderness man na. Ang sa pag deep palpation, circular motion gapon or daily?
Ay, circular motion. Okay. Again,
After
deep
palpating
palpation.
the four quadrants using light and
Is there any
deep palpation, I will
Here,
now
sir?
proceed to palpating for the kidneys, the liver, and then the spleen. So for the kidney, I will palpate on both sides.
Next is we're going to palpate the liver, kidney each side, and the liver for in the right costal border, and then in the spleen in the left costal border. So first
And
is
then
we're
I
going
will palpate for the liver
Okay,
at
sir.
the right costal border by using the scooping method. And then I will palpate the spleen over at the left costal border. After
And then
palpating,
liver,
I
using
will
the
now
scope of the
proceed
hand.
to checking for rebound tenderness. So I will using the fingers and my hand, I will gently and
Next is
deeply
the spleen. So
palpate for rebound tenderness. And then if the patient complains of any pain and discomfort,
and then
so
next is
I
we're
will do
going
the
to
rebound tenderness lastly.
after
Ang saan may pag-stream o liver?
palpate, sir, the
Asa ka
left
tayo yung scope?
costal.
And make sure that
Sa
the
liver to,
motion
dili,
is
sa
fast
right,
and rapid.
Oo.
sa right costal border.
Sa spleen, okay.
Sa spleen sa left costal border, sir.
Palpate ra to.
Yes, sir.
Palpate ra to.
Yes, sir. Palpate. Ang scope, sir, sa liver.
And then after checking
Next
for
is
rebound
the-
tenderness, I will assess.
After that is we're going to
Palpate
assess for rebound tenderness using the finger and the finger and the
the
hands.
groin area on the
Is it-
femoral pulses. So
Do you feel any pain, sir?
then afterwards, I will use the stethoscope to auscultate.
Next is we're going to palpate the femoral pulse of the patient. So next is we're going to use the stethoscope.
Okay ra ka diha.
So we're going to auscultate.
And then after auscultating, I will
Okay.
so afterwards,
After that is we're going to after the procedure. So we're going to help the patient dress the removing the gown and
make sure that
dress
they
the
are in comfortable position.
Next.
then perform the hygiene and ask the patient, help the patient into comfortable position, and then after that is document the procedure and document the finding. Thank you, sir.
Thank you.